Hi, welcome to our webinar on digital transformation, what healthcare can learn from other industries. So I'm really excited about this topic because as we've shared many times on digital transformation and in these webinars, while healthcare, we do some pretty awesome things to help save patients' lives and increase the quality of care and impact revenues in a positive way and make sure that we take care of the dignity of death as well as all those other things. We have a long ways to go. And one way of sort of catching up and accelerating ourselves is to learn from other industries. So I'm so excited to have my friend, Steve Lee, with us today, who has a background. He's now in healthcare and joined us, but he has a background in, of all things, sort of airports. And you'd think, oh, wow, what can I learn from airports? A lot. So Steve, thank you from Singapore. Thank you for joining us. And please introduce, we have your slide here, but please add a little color to it, introduce yourself, and tell us a little bit about your career journey.
Thanks, Ed, for the kind introduction. I'm really pleased to be here. I don't know how much I can share, but I'll try to see, to share what I've learned in my past experiences, especially in my last 10 years in the airport, in the Singapore airport. Prior to the airport, I was in a conglomerate, and we do all kinds of things from shipping to trading in China, in Singapore, Malaysia, and in Asia. And prior to that, I was in the Air Force, the Singapore Air Force, nice. and also did a stint in all kinds of technology management there. So I'm really glad to be here, and I hope I can share, and hopefully I can also learn from some of you and get connected to you guys, because I'm new to the industry and I need all the help I can get. Thanks, Ed.
Yeah, you'll find that everyone is so welcoming and accommodating in our circle, and you'll make fast friends who are quick to share and learn from one another. So what we thought we would do tonight is have Steve share a little bit, because the airport will be new for most of us. All of us travel, but have you ever thought about the technology that enables modern airport to work? So Steve's going to take us through short slides in terms of airports, what they are, and the ecosystems that exist within them, and then we'll go into some Q&A. Remember, this is live, so please use the question box on the GoToWebinar and put in your questions. I'll moderate them, and we'll try and get to everyone before the end of the 30 minutes. So with that, Steve, please.
Thanks, Ed. I took the liberty of using one of the decks that I presented when I was in Changi to the Singapore Institute of Directors, and it's about innovation. But I thought it's a good set of slides that I can quickly run through in 5 minutes to give you a sense of some of the things we do, and maybe we can have a chat from there. So in case you're wondering, an airport, I mean, unlike these days with the COVID, but before the COVID, really it's a busy, complex system of systems. So for example, last year before the COVID, we carried about 65.5 million passengers a year, and there are about 386,000 movements of aircraft in a year in the airport. So that's a lot. So next slide, please. Next slide, please. But a lot of people travel to the airport, but they don't realize that actually an airport is not one organization. It's actually 200. In Changi, for example, there are 200 organizations with 10,000 frontline staff and 50,000 staff in total, including the people who load your bags in the bag, service the aircraft, and stuff like that. And there are these 200 organizations working together seamlessly requires a lot of technology. And for us to serve the 185,000 passengers that travel to Changi every day, that requires stringing this technology well and making sure that people have the right information and the right technology to do the work well. Next, please. As in all, I think this is quite similar to health. We call it a smart airport, and actually there are 5 main reasons we want to do this stuff. You can read for yourself. I don't think it's very dissimilar to a smart hospital. Personalized value to customer, performance and productivity, dealing with business complexity, of course financially prudent, and safety and security is high on our list. All right, next please. And just a little word about innovation. So as in airport, as you can see, as in a hospital, safety and security is very important. Whenever we want to innovate, safety is of utmost concern. And clearly to do that, I always coin the term, like it's only 5% inspiration, but actually 95% respiration, because there's so many things that are going and working well in airport. How do you do innovation in that context? And I'm sure I think it's quite similar in hospitals. And of course, the most important thing is, and we always tell our folks, whatever you do, 5% inspiration, 95% respiration, but most importantly, 100% focus on customers. Because if imagine there are 200 companies with 50,000 staff, people can easily lose focus on the customer and focus on their own stuff. In my last 9 months in the hospital and in the system, I think the challenges are similar. Yeah, next, please. Okay, so I'll just quickly spend about a minute or two going through some cool ideas we've done. We have AI for predictive maintenance. We put sensors in a bag that you can check in, and we use the bag to detect failures in the belt system. The belt system is like 20-30 kilometers in the airport. It's like the thing you swallow in your gut to scan for gut problems, but this one does for the baggage system. Next. Nice. We use AI to, because we have a lot of images that detect stuff on the runway which can be dangerous. So instead of having a lot of false alarms, we use AI to train the images that we collect, that the operators feel that it's a false alarm, and after a while we can reduce the false alarm rate, which improves operation, which means it reduces the time the runway is closed and therefore maximizes operation. I think some similarities to health. I can think of many false alarm reduction methods that can help clinicians and hospitals. Next. We use video analytics. In this case, we partner with a startup and we incubated them, and we invested in them, and we come out with cool technologies to track queue. This is not a standard queue. It's a very complex queue with all kinds of merging traffic, all kinds of glass doors in between that confuses the AI algorithm. So it's a very contextual image recognition engine that we trained. So this is good for monitoring if queues build up and we can respond quickly. Next. Yeah, we seldom have passengers without trolleys, but partly because we track the arrival flights and we know people who are coming, and we know when the trolleys are there are shortfall of trolleys through some sensors that we put at each of the arrival points. So it's quite a cool system. We've implemented this for more than 5 years, maybe more. Yeah. Next, please. For turnaround in an airport, many people have to work together. Remember, in the air side, maybe at least 20-30 companies have to work together for one thing only, to turn the aircraft around, and they are not always from the same company. So what we do is we use this to make sure that the turnaround process is as smooth as possible, using video analytics to understand which vehicles, which equipment have come and which have gone, and they all work towards off-block time that everybody. Off-block means the time the aircraft pushes back, that is synchronized and everybody knows that they are working efficiently. Next. In Changi, we were proud to be the first airport in the world to use facial recognition from end to end. So in Terminal 4, if you are a citizen or frequent traveler or registered traveler, you could walk from curbside to the airplane for international travel without seeing an agent, because the facial recognition process is embedded in the check-in, in the backdrop, and in the gating process together with immigration. So it's a fully facial recognition approach. Next. We use AI to predict landing time. So this is quite useful for us because we could anticipate demand. And if you look at the chart at the bottom right, we are able to predict demand out 2 hours, 4 hours with some accuracy. And based on that, we are able to allocate resources For example, one of the downstream process of an arrival is the immigration check-in hall. So how many times have you come to an airport and have to queue for a long immigration check-in? So what we do is that we have many methods. We try to change the gating. We try to change the allocation of staff for immigration and all those stuff, so that we can balance the load. So when I say change the gating, I mean instead of parking the plane that requires 5-minute walking time, we may make it 7 minutes, so that we would instead of everything showing up at the immigration at the same time, we just depict it a little bit. And yes, it's busy, but it's less busy than it would if it had just all come at the same time. Next, please. And we track taxis, and we're able to know the speed of taxis in the airport system. We know the queue. We know are taxis needed, and therefore we are able to work with the taxi companies and of course Grab and all those to manage the supply. Our objective is to make sure that every passenger gets a taxi as according to our performance target, which is very, very high, and minimize the waiting time for taxi drivers too, so that they are not so grumpy when they pick up the passengers. Yeah. Next. We have a smiley face system every month, which is you know, are you happy with service? And if you're not, tell us what's about. Every month we have almost 2 million feedback. So people care, and they are willing to give feedback, and this feedback allows us to drill into many things in data analytics that we could not otherwise do if you just had a regular feedback system. So we could slice and dice by time, by location, by reason, by response time, by whatever you feel it's important. So that's quite powerful. Next. We have a platform to harmonize data. I think this is quite straightforward. I think every hospital should have this, some kind of command and control system where you can harmonize data and everybody has the same situation picture. I mean, I can talk about hours on this, but I think the main point is lots of confusion results in lack of productivity, and sometimes can be safety issues. So a common picture is worth $1 million or more. Yeah. Next. Yeah, and then this is one slide, which is actually 20 slides, but I only made one slide because it's commercially sensitive, but the airport is actually also a very large shopping mall. We make more money from our commercial than we make money from aircraft landing and passenger charges. And therefore, we invest like in every large commercial enterprise into analytics. So we have data management, analytics, Wi-Fi analytics, chatbot. I think this is quite useful for health because clearly as I enter into health, I realized that there's a lot of social, economic, and marketing type things that health services can do. Not to get more patients, but more to help them with advisories to shape their behavior so that they are healthy and so on and so forth. I'm speaking from a Ministry of Health perspective rather than from an individual commercial hospital perspective, where the end outcome is to improve health. And I see a lot of commercial practices in this area of commercial retail analytics and online analytics that can be really useful for health. And this one area that I intend to invest a lot to transfer that kind of knowledge into health, population health and stuff like that. Okay, next. Okay, that's it. I will stop there. So maybe I take some questions. Yep.
No, Steve, that was fascinating. I wrote down at least 10 different things. Almost everything that you shared has a corollary in healthcare. There's no doubt about it. And I couldn't help but smile because, you know, I'm at a big airport, Dallas-Fort Worth, one of the larger ones in the world.
Don't say anything bad about them because the CIO is a good friend of mine.
Yeah, I love DFW 4. It's awesome. It really is. The only frustrating thing, right? Because I always think about it too, as a passenger or as a patient probably thinks in the hospital, I just think, how come they don't know that we're at the gate waiting for the person to come down to move the gate so we can get out of the plane? So like 25% of the time, the captain gets on the overhead on the plane and says, hey, we're sorry, we're waiting a couple minutes for the, I don't know if they call it gate agent, the gate agent to come and open the door or something. And I'm always like, don't they know ahead of time? Well, of course they have the capabilities like you guys did to have that predictive capability and make sure that someone's there to greet us. But yeah, that it's very fascinating, and you can see the corollaries. So I had a couple questions, Steve, for you, and we're about halfway through. The time flies on our webinars. We're about halfway through, so if you have any questions, especially after Steve went through just the amazing different things that they did at a airport, if you have any questions, feel free to jump right in and enter your questions, and we'll certainly get to them. So how do you have a sense, Steve? I know you've only been in healthcare for 9 months now. When you think about the IT staff, like at an airport, for a large airport and all that you did compared to healthcare, was it a pretty large IT team, or how do you think they compare, if you've had enough experience yet, the size of IT staff that it takes to run a complex airport that it takes to run a complex hospital?
I don't know how to compare, but one thing, a staff in a large airport like Singapore or Munich or San Francisco, it's easily around 200 people.
Yeah.
That's it.
Yeah.
Because a lot of the systems we operate are built by other people. So they focus on the engineering transaction systems. And what a good airport team would do is make sure they control architecture, integration. They are the brains lah. So of course, these guys, we hire the best. We hire the people who already done it, and they become the master planners and architects. So in a way, we call them the orchestrators rather than the doers. But of course, we have strong operations team. If there's a large staff, that is in the operations team, because in the end, the IT team and the operations team in airport are there to serve the customers, and the responsiveness for operations is very important. So we have a strong focus on operations, but again, to manage the partners rather than to do it ourselves. Right. So that's the approach taken. And I think in hospital is maybe a bit the other way around. There are a lot of stuff. Yeah. So I don't know why, but that's the nature it is, I guess.
Yeah, you're right.
I'll find out why. Yeah.
No, it's a fair observation. That's why I was curious, because I think we've allowed, this is personal opinion, through observation and experience, we've allowed our IT staff to get rather large when our focus should really be on the architecture, the orchestration, the leadership, on the experience, and let someone else handle, some of the other things, so that you can focus on what you do best in helping to run a great airport. And the same thing, great hospital. I think sometimes we've allowed ourselves to become experts in data center or something when we really don't need to, and those dollars could be spent someplace else. You touched on, like I said, many different things. So I want to go deeper, maybe in one or two areas that I have personal interest in. I know the audience does as well, and that's the customer experience. Can you speak a little bit more to the customer experience, how you talked about the customer experience, how important that was, and maybe one or two things that you did that was, unique, game-changing in that time? Probably everyone copied you since then, but when it first came out.
So, I mean, the smiley face is a good example. The smiley face, because it's not just a smiley face, it's linked to a phone that's linked to a response team. And the smiley face, when we did it 10 years ago, it won quite a few awards, and today everybody is doing it, at least in Singapore and in some countries. Worldwide, I see other airports doing that too. And actually, it saves a lot of money. And more importantly, it shows the customer that you care, because you are taking the feedback at the point of service.
Yeah.
And you can respond. And when you can respond, it's not always, customers are sometimes not happy with service outages. But if you can do good service recovery, they are always very happy. So we call it service recovery. Yeah. So that's one area. The other area I thought was very interesting is user-centric design. So we look at the other example, which is the facial recognition. It took us almost three years of experimentation on user design. That means how high should be the backdrop, what eye level, what color, what does the kiosk look like, the screen design, the flow, the testing. So those are all very important, the lighting conditions. Beyond the technology of the facial recognition are all these design factors. So we had live trials and various things, operational trials. We call it ops tech integration. So that in the end, the thing works. This came from my military experience, because in the military, when you do stuff, people die. So you really test all this, what we call human machine interface. You're very, in a way that is connectively easy for the patient. And then of course, line of sight design. I think hospitals can do better there, where things are natural rather than we move. If you go to T4, you realize that we move away from the industrial design and we move into aesthetic design, more experience based rather than industrial. You finish step 1, then you do step 2, then you do step 3. But it takes a while because you need to spend money on infrastructure, and you can only do that when you have a chance to upgrade your infrastructure.
Yeah. Well, tell me a little bit more about, so what are some of the skill sets? So, when you talk about user experience, customer experience, and moving from industrial design to customer-oriented design, if you will, what sort of skill set? So, like when you think about healthcare and hiring people, what's the sort of background of a person that might be good in that?
So now, I mean, this is my personal belief, and I don't know if it's true or not, but to be panned out as I try this, I believe that most of the technology that I briefed just now, 90% will be commoditized in a couple of years, if not already. So the trick is in orchestration and ops tech integration, service tech integration. So really, I think is to train operators and users, business users, to be more tech savvy. And the IT should be focused on the deep tech plus the integration and the security. And the innovation must be in the way of working, in the way operators and users work to get the best outcomes, and in very narrow ways rather than in, I mean, for example, I never like a data lake, because a data lake is just a lake. Whereas I would rather talk about taking data necessary to predict a landing time 2 hours out, so that someone can change the concept of operations for immigration management. So that's the whole thing. That's what I meant. I think increasingly that should be the way we should train our technologies and our users. I don't know whether it makes sense. It makes a lot of sense to me because it works.
No, I get it. I mean, I think the majority of our audience gets it, because we all fly, and all those examples you were giving, I mean, immediately healthcare came to mind, healthcare scenarios. Let's dig deep into one other area. So I'm a big believer in user experience, customer experience, so I appreciated that deep dive. The other area that I think most of our listeners are really passionate about is safety and quality. And obviously, airports, flight in general, right, is probably the #1 industry. Maybe I don't remember the exact data point, but it's 5, 6, 9s, because people's lives are at stake. Healthcare, I think sort of our history. We're not at the same level of safety and quality as flight. So what is maybe one thing sort of that you've experienced or you've developed that you think about, safety and quality that might apply to healthcare? That's something we could do in healthcare.
No, I think actually in my concluding slides I mentioned AI and humans. So I called it assimilating AI. So one of the ideas we did, for example, in the flight, the detection of debris on the runway, that is quite dangerous, because the aircraft can crash due to debris on the runway. And what we did was we used AI to look for the type 2 errors, which is the false alarms, so that it reduce the noise for the operator, so that you can focus really critically on the important stuff. So in a sense, using AI to augment an operator in a symbiotic way, so that actually it's a AI augmented human to improve his detection and reduce his false alarm, and therefore helping him to do his job much more effectively. I think that is the example I have in airport. But in health, my mom had stomach cancer, and one of the lucky God's grace that she survived, and she was stomach cancer, was that she was detected by a very experienced endoscopist who was trying to remove her stones in the kidney stones. But luckily he was an expert, and he could see it, and there's a walk in the park for him. But imagine this was a junior learning doctor. I don't think he'll be a walk in the park. He'll be cognitively burdened just to do his job well. So I brought to him an idea of a black box, very much like an aircraft industry black box, where actually, you could record this stuff in a systematic way, collect the data, and then either post event, it's analyzed, or it's just used as a data set for correlation to future events. So in that way, actually, over time, maybe you can improve detection for other diseases or stuff that might not be the primary focus of the operation or the procedure itself. I don't know whether that makes sense. It's called a medical black box. I thought I just coined the idea myself. I thought it sounded cool. So, does it make sense?
Yeah, totally. No, I love the idea. My mind is churning. This is such rich. Like when we talked about, when we were first talking about coordinating this webinar, that we could spend hours on this topic because it's so rich of information. So we're down to 2 minutes. So let me ask you one final question, and that is, what have you learned? And again, I am putting you on the spot. I know it's only been 9 months in healthcare. Is there anything that you learned in your 9 months in healthcare that if you went back now to airport that you would bring with you? So is there a new learning, an aha moment that you had in your brief healthcare experience that you would take back with you to the airport?
I have an observation. I don't know whether I can bring it back though. That's the only thing. I noticed that the healthcare professionals are very passionate. They're very passionate. So quite important thing. Passion and commitment to the purpose. I think that is undeniable advantage that I can see. But on a technical basis, I guess, well, I guess the way the hospitals really go all out to take care of a passenger, or rather a patient, because in airport, while we say we try to personalize, actually we're just trying to do it in an as cost efficient, as productive a way as possible. Whereas when I look at the healthcare sector, I can see really, I use the word customization in a good way. So maybe that's one thing I would try to scale up customization in airports more. But it's tough because if you have 65 million, how do you personalize a service?
No, it's a valid point. It's hard to explain without coming across arrogant. It is a special calling, I think, in healthcare. People are in it not so much as a way to make a living, but because there was something that caught their attention that resonated with who they were, and they just wanted to give their life to it. And that's a very general statement. I know it's not true in all cases, and there's nothing wrong with being an IT professional in other industries. We need them. We need great airports. We need great everything. So, but there is some intangible difference. It's hard to put your hand on it. It's hard to create it. I mean, one of the things, Steve, that and we'll wrap up with this, that I used to do to make sure all my IT caught it, was all my IT staff had to spend at least a day a year working with a nurse or a physician or a lab tech, so that they didn't forget that we were in healthcare and it was this sacred life and death situation. And then I would do the same myself in a variety of ways, but really have the time today, or that's not really the focus of today. But this has been so incredibly insightful, Steve. I know that our audience, both the live audience and the audience that will see this later, will truly be fascinated by this. And we'll have to figure out a way to get this out even further, because so many lessons to learn. And I'm so glad that you're in healthcare. And thank you for being my guest.
Thank you very much. Bye.
So we have upcoming webinars. So we have another one on digital technology, which is related to what Steve and I were talking about. And that's coming up in a week or two. And that's really on this human-centered design. And then we have the rise of the Chief Digital Officer. What does that mean for the Chief Information Officer coming up also with Hillary Ross. And then our continued series on race relations, really important topic. We've been doing it for 6 months. This one will be with Irvin Bishop. You'll love Irvin. He comes from outside of healthcare like Steve on purpose. And so then finally, you know, what are successful brands doing to engage and enhance experiences? The things that Steve and I were talking about is perfect. So stick with us, join us again. Thank you, everyone.